is bipolar disorder? Bipolar disorder is a mental disorder that can cause unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. I have a chart here just breaking down some statistics, and one of the biggest ones is that the US has the highest level of bipolar disorder with 4.4% of the population having it. So there is manic episodes versus depressive episodes when dealing with bipolar disorder. Manic episodes are periods of being extremely up, feeling elated, overly irritable, energized behavior. And then depressive episodes are feeling very down, extremely sad, indifferent, and hopeless periods. There is also hypomanic episodes, and these are less severe manic episodes. There are three different types of bipolar disorder. The first one is bipolar 1 disorder. These are manic episodes that last at least 7 days, manic symptoms that are so severe that the person may need hospital care. Depressive episodes occur as well, usually lasting for at least 2 weeks, and having depressive symptoms and manic symptoms at the same time is possible. Bipolar 2 is a pattern of depressive episodes and hypomanic episodes, and it is not full-blown manic episodes. And then there is clyptomythic disorder, and this is periods of hypomanic symptoms, periods of depressive symptoms, and this disorder lasts for at least 2 years or 1 year in children and adolescents. And sometimes a person might experience symptoms of bipolar disorder that don't match the three categories listed, which is referred to as other specified and unspecified bipolar and related disorders. I really like this chart here that kind of gives you a visual of the three different kinds of bipolar disorder compared to an average person and someone with depression. So as you can see, the bipolar 1 is the light purple, and that goes down the lowest to depression and up the highest to mania, whereas the quote unquote average person, which is the green line, stays pretty steady in the middle. So bipolar disorder has been around for a very long time. The earliest was 300 to 500 AD, so there's a ton of history on it. Going over some of the more recent history, in 1950, there was a German psychiatrist who initiated classification systems that led to the term bipolar. And this was the first time there was differentiating between unipolar and bipolar depression. And he said that once there was a difference between bipolar and other disorders, individuals suffering from mental illnesses were better understood, and in turn, along with the progress, were able to receive better treatment. And in the earlier days before this, people with bipolar disorder and all mental health really were not treated well. Still, there's a stigma even to this day, and we're getting better. But this was the first time that there was someone who was differentiating between unipolar and bipolar. A monumental change was the Diagnostic and Statistical Manual of Mental Disorders, the third edition. And this is when the term manic depression was dropped and bipolar disorder was introduced. And this also eliminated references to patients as manics, which was very degrading to those who had bipolar disorder. And in 2013, the DSM, the fifth edition, came out, furthering the science and education on mental health issues. And there is still a stigma on mental health issues today, but it has definitely gotten better. People are no longer being admitted into psych wards. Education still needs to improve, especially in younger grades, so students can understand what mental health is and that other people may be feeling the same as them. This is the diagnosing of bipolar disorder. So I have a case study. This is Anna. Her parents have noticed some of the signs of bipolar disorder. What are the next steps? So first she would take a physical exam, and this is just a normal physical to make sure that there are no underlying health concerns, and this came back normal. There would next be a psychiatric assessment, and this is where your doctor would refer you to a psychiatrist who would talk to you about your thoughts, feelings, and behavior patterns. And you would also fill out a psychological self-assessment or questionnaire. And in this case, Anna's psychiatrist noted that Anna describes periods of time when she feels super low and in a rut and she can't get out of it for a few days. She then says there are periods of time where she feels super energized and feels like she could take on anything that comes her way. Next up, there is mood charting, and this is where you would be asked to keep a daily record of your moods, sleep patterns, or other factors that could help with diagnosis and finding the right treatment. And in Anna's case, with the help of her mom, she filled out a mood chart for a month. It was found that she has difficulty sleeping and staying asleep and is only averaging about 4 hours of sleep a night. And then lastly, there would be criteria for bipolar disorder. And this is where the psychiatrist pretty much just compares your symptoms with the criteria for bipolar and related disorders from the DSM compared to other people that have bipolar disorder. And Anna's psychiatrist noted that she sees similar patterns with Anna compared to other adolescents her age who have been diagnosed already. And I just want to state that diagnosing children and adolescents with bipolar disorder can be very challenging. The symptoms are similar to other mental health disorders such as ADHD and anxiety disorder. There also may be larger gaps in between episodes when looking at adults with bipolar disorder versus children and adolescents with bipolar disorder. So based on everything you have learned about bipolar disorder thus far and the specific information on this slide, do you think Anna was diagnosed with bipolar disorder? Why or why not? Next up is the school placement. It is really common for students with bipolar disorder to also have another diagnosis, such as ADHD. Because of this, each case is so different and every student may require something different. And it's important to note that a lot of students with bipolar disorder may take medication throughout the day. So as the teacher, you need to know when they take it and what is the process for them. I also have a chart here that goes over some of the biggest triggers in bipolar disorder, which again, as an educator, is super important to understand. And here we have the different adaptations and modifications in the classroom. So some of the big ones were to designate a cool-off space where the student knows they could go to if they are having a manic or depressive episode. Modify school arrival, meaning that because a lot of people with bipolar disorder struggle with insomnia, trying to have a child up and ready at the start of the school day can be challenging and detrimental to their mental health. Having them start the day off later could help them with productivity and behavioral issues. Providing small class sizes and having minimal distractions. Also, consistent scheduling. So you want to create a schedule and stick to it and limit any surprises throughout the day. Next up is focusing on quality, not quantity, and this can be said across the board in any classroom, focusing more on having the student master the content rather than overloading them with work. And then finally, preferred scheduling. So if you know the student has a hard time around 2 p.m., don't schedule them to take one of their more challenging courses at that time. Have them take their most challenging courses at the times that work best for them. And then I have a chart here because bipolar disorder and ADHD do overlap, just going over the differences between the two, because because they are common doesn't mean every child with bipolar disorder is going to have ADHD. So it's important to see the differences between the two. And the two questions I have are, what are some of the common triggers in bipolar disorder? And what is the difference between a manic episode and a depressive episode? I hope you all learned a little bit more about bipolar disorder through this presentation.